Hello, this is Dr. Do again. This video is on arthritic disc problems. Continue with letter G. Yesterday I talked about the glucocorticoid actually. Today I'm going to continue with that topics, including the mechanism of glucocorticoid and the regulation of glucocorticoid, and also the side effect, which is a very significant clinical concept. So everybody, whoever has to be on glucocorticoid, for example, the rheumatoid arthritis, or the gout, or the lupus, or any other conditions, who is on long term of glucocorticoid, really a big concern is the side effect. So I'm going to put everything together, just give a summary for those, probably for those people you're taking this, you already know, but just give you some explanations. So like previous video I mentioned, glucocorticoid is synthesized by the adrenal gland, and it's regulated by the pituitary, and also the above level of hypothalamus. So basically, the pituitary synthesizes the ACTH, responding from the hypothalamus, and then this ACTH function as the adrenal gland to secrete the glucocorticoid. So this is the mechanism of this, and the function of glucocorticoid is not like insulin, for example, binding the receptor located on the cell membrane and regulate the glucose intake. But this glucocorticoid, the receptor is on the DNA, so it's regulated at the gene level. So glucocorticoid, since it is hydrophobic chemicals with lipid, freely passing to the cell membrane, binding the protein, which is called hormone binding element, and regulate gene transcription, DNA synthesis, and then regulate the function. So this is kind of taking time to really start to function. So this is the fundamental of the mechanism, how the glucocorticoid to start and to function as a hormone. Steroid is a hormone. It belongs to this axis from hypothalamus, pituitary gland, and the adrenal gland. So this is, and the side effect. The side effect of glucocorticoid is kind of, first of all, if long-term taking glucocorticoid, the body fat will undergo a redistribution. What does that mean? Usually we have the fat deposit for man or woman has a certain pattern on the fat tissue, extra weight deposited in the abdomen or the hip area. But after taking a long time of this glucocorticoid, the fat deposit change the pattern. It's like the face, it's like a full moon face, and the buffalo hump, which means the back. The back has a deposit of the fat, and also really like the thin of the extremities. So that's the very important side effect from the glucocorticoid. Also, that's obvious because the skin became thinner and dried, and also some other significant systemic side effect. For example, the osteoporosis. Long-term taking glucocorticoid will increase the risk of osteoporosis. Of course, increase the fracture in older people, elder patients. And glucocorticoid, either systemic use or local use, can cause the eye problem, glaucoma, increase the eye pressure. So which is really one of the presentation or the risk for glaucoma. So these are the side effects of the glucocorticoid I can think of. And what kind of people really use glucocorticoids for treatment purpose? Like I said, glucocorticoid anti-inflammatory, regulate the immune function, has multiple variety of function. For example, the autoimmune disease like rheumatoid arthritis, lupus, these kind of people, they tend to use this steroid or glucocorticoid. Or some cancer people actually also can be treated with this, either to prevent the side effect of the chemotoxicity, or really itself has the function to regulate immune function and then to treat the cancer. Also, anti-inflammatory, that's the most widely used function of glucocorticoid. Anti-inflammation, for example, very obviously is the brain, for example, brain edema caused by viral infection, encephalitis. Viral encephalitis can actually sometimes increase intracranial pressure. It's very, very dangerous if it is caused by the, regardless what is the cause, but sometimes acute phase with fever, lost altered mental status. So this gives some steroid or glucocorticoid will really anti-inflammation and bring this swelling of the brain to shrink it, to decrease the swelling. So that's very significant actually in this acute situation. So talk about this clinical application for this glucocorticoid. Talk about the side effect. There's another special scenario for this glucocorticoid, which is increase the risk of the ulcer. It's not just from the exogenous you take glucocorticoid. Actually, it is from the internal. It's under the severe stress situation, the body under severe stress situation, for example, acute trauma. So this is called stress ulcer, which means the body is kind of battling the change of the homeostasis. So suddenly burst secretion of this glucocorticoid and has the burden of the digestive system, cause the acute ulcer, and a patient can have the huge amount of blood from this stress ulcer. So this is some I can think of the clinical application, the mechanism, and the side effect, and the regulation of this glucocorticoid. The other important concept or information about this, probably if you take it for a long time, you already know, has to be tapering. Why has to be tapering? You cannot just, I took it today and then like antibiotics, I take 5 days and then that's the course, I stopped. But glucocorticoid has to be tapering down because of this endocrine axis. So if you take exogenous glucocorticoid, inhibit the hypothalamus or the pituitary, so the ACTH is not there. So after you stop this glucocorticoid, it takes time to really re-establish this axis to synthesize steroid and to function at a gene level. So this is basically the fundamental concept of why the glucocorticoid has to be tapering down. Again, my information here is for those who has been on this glucocorticoid for a while and systemically, not locally like the asthma or not on the skin, but it's just systemic use of. I did not mention about the asthma or the ointment because I'm talking about the systemic application for this glucocorticoid. So I'm going to stop here, and I hope this is probably the video just I present this video for remind you and to explain to you and that you can understand. And the most important taking home message is if you're on systemic glucocorticoid, follow your physicians and tapering doses and to keep in touch with them just in case there's some side effect or just follow up for the long-term management. I'm going to stop here. Thank you for watching. I'll see you next time.